Hello. I'd like to continue our discussion about preventative medicine, about these very important topics of identifying hypertension, identifying diabetes, And here are the risk factors. If you smoke cigarettes, that counts as 1 point. If you have high blood pressure or take blood pressure medication, that counts as a point. If you have a low HDL, that counts as a point. Why? HDL is the good cholesterol. You want your HDL to be high, up above 40, and that will help prevent atherogenesis. Okay? If you have a positive family history, that is a risk factor. If you're older, well, if you're over 45 for men, that's a risk factor. Okay? Okay? So if you have more than 2 of these, then you want your LDL goal to be less than 130. Okay? Kind of confusing, I know. So think of it this way. If you've had a heart attack, or if you have some type of other sign of hardening of the arteries, you've got a stroke, you've got peripheral vascular disease, you've got diabetes, then you Now, what medicine do we give first to lower the LDL? As a general rule, we give a statin drug, one of the statins. It lowers the LDL, and the statins have been shown to lower mortality the most. And since we're trying to prevent death, this is the perfect drug. Okay? So statins is the first line of drug. What are the side effects of statins? Well, you could have liver dysfunction. Patients can get jaundiced, so you monitor the liver function tests. And you should inform your patients if they ever get a All right? The higher your blood pressure, the higher your risk of coronary vascular disease, CVD, coronary vascular disease. All right? All right? So it's a continuous thing. It's not that 120/80 is some type of magic number that makes you safe. For every elevation of 20 points systolic above 115, your risk of dying from heart disease is doubling. Okay, so the lower the better. Okay. If you have a patient with prehypertension, and the blocker, ARB, beta blocker, you can BB, beta blocker, you can give a calcium channel blocker, CCB. And somewhere in the test question for the test, they'll give you some reason to pick one drug over another, right? So if they tell you that the patient also has hyperthyroidism or they have some type of myocardial ischemia, well then certainly beta blocker would be a good choice. If they tell you they have some type of problem with heart failure, well maybe you're going to add lisinopril, ACE inhibitor. All-important obesity. How do you treat obesity? It's kind of like smoking in that you talk about the patient's weight every visit. You talk about the therapeutic lifestyle changes every visit. You talk about their nutrition, their need for smaller portions of food, the importance of eating fruits and vegetables and whole grains, the importance of not eating too many sweets and fried and fatty foods, the importance of exercise, at least 20 minutes 3 times a week of walking. And that's the main issue. You can refer the patients to dietitians. You can screen them for depression. Perhaps the patient has an eating disorder, right? Patients that eat uncontrollably and have a sense that they're not in control of their eating have eating disorders. Okay. There's also medication that you can use for obesity, which are approved. They don't seem to be the greatest, but they work for some patients. One is Meridia, sibutramine. This is a generic. And this is an inhibitor of norepinephrine and serotonin. So, the side effects here are hypertension and tachycardia. And since so many patients who have obesity already have hypertension, it's not a very good choice for those patients. It's going to make their blood pressure go even higher. Another drug that's approved on the market for the treatment of obesity is orlistat, marketed as Xenical. And this stuff inhibits your pancreatic lipases. So it prevents the absorption of fats and fat-soluble vitamins. It gives you steatorrhea. It gives you, frequent uncontrolled urge to defecate of kind of oily, slimy stool. I mean, this does not sound like fun. So most of the treatment of obesity is still counseling, diet and exercise, and it's really a lifestyle change. Not that I'm going on a diet for 3 months, I'll lose the weight and then stop. It's a commitment to a lifestyle change for the rest of your life. Okay? Who is the gastric bypass surgery reserved for? Those are patients with BMI over 40. And these patients are going to have B12 deficiency, and there's a very high incidence of complications just from the surgical procedure, as there's higher risk from anesthesia and blood clots, pulmonary embolism, DVT, and recovery from the surgery when you're very overweight. Thank you. That is the conclusion of the hypertension diabetes section.